and welcome back to my channel, Kidney Care Coaching, a place where you can get exclusive videos and content pertaining to chronic kidney disease, prevention, management, and treatment. In today's video, I'm going to discuss the symptoms of kidney failure. Before I jump into the symptoms of kidney failure, first you have to understand what the kidney actually does. So I'm going to go through the most important functions of the kidneys. First of all, the kidneys clean the blood of poisons and toxins. 24 hours a day, 7 days a week, the kidneys are cleaning the blood of poisons. The kidneys also help remove water from the body, from when we drink our lattes, our coffees, our water, our juice, Pepsi, Coke, Dr. Pepper, whatever. There's water in those drinks, and so the kidneys help filter that water from our bodies so it doesn't hang around in our bodies and make us sick. Another function of the kidneys are to produce a special substance called erythropoietin. This substance helps stimulate the bone marrow to actually make red blood cells. Red blood cells are important because it helps circulate the oxygen throughout our bodies. And one of the other functions of the kidneys are to naturally regulate our blood pressure. So the kidneys are able to do these functions naturally 24 hours a day, 7 days a week. So you can imagine if any of these functions aren't on par, that these symptoms can possibly show up. So the symptoms actually make more sense when you actually have an understanding of what the kidney actually does. These symptoms are in no particular order of importance or significance, but in combination together and with other conditions, they can be very important. I'm gonna have to look down so I can make sure I don't miss any of the symptoms, okay? So if I'm looking down at my list. The first symptom is nausea. Nausea could be on and off. It could be consistent, it could be intermittent, it could be persistent, it could be in degree of severity, meaning it starts off, you were nauseous a little bit, now you're nauseous all the time, now you can't even really function. So nausea is one symptom of kidney failure. The second, and also I want to mention why, because like I mentioned before, when the toxins and poisons build up in your body, that the kidneys aren't getting rid of, then you can become nauseous from those toxins and poisons in the body building up. One of the second symptoms is vomiting. Vomiting could be on and off, it could be constant, it could be persistent, what have you. But if you're experiencing nausea and vomiting and you're not a GI patient, you don't have, let's say, gastroparesis, you're not pregnant, you don't have the flu, if you have persistent nausea and vomiting, it is a strong possibility that you could actually be in kidney failure, okay? The third symptom that's very common is patients will have a metallic taste in their mouth, almost like they're sucking on a penny or some sort of metal. It's metallic. It may or may not go away. It may get stronger. It may be very light. But that is definitely a symptom of kidney failure. Another one is going to be swelling. Swelling of the face, hands, and feet. It could be worse in the evening after you've worked all day. It could be better in the morning after you've been laying down. But swelling of the face, hands, and feet is another symptom of actual kidney failure. Then we have some people are unable to eat. They have poor appetite. They may or may not experience some weight loss with the poor appetite. Another symptom is cramping at night. Sometimes a person has started a new exercise program, and so they may experience some cramping. But if you know you haven't been doing any different exercises, and when you lay down at night, you're having cramping, especially in the lower extremities, that's a strong possibility that you could be in kidney failure. Another one that's it may or may not be harder to detect, depending on if you check your blood pressure at home or if you know what it feels like to have low blood pressure, high blood pressure. The next symptom is uncontrolled blood pressure. If you're having uncontrolled blood pressure, you're doing everything you're supposed to do as far as taking your medication, staying away from salt, but your blood pressure is still uncontrolled, that could be a symptom of kidney failure. And if you're being followed by a physician, they're of course checking your blood work to know that whether or not you have kidney failure or not. And so all of these symptoms in combination together could mean you're in kidney failure. And what's even more significant is if you've been ever diagnosed with chronic kidney disease in the past. It could have been 5-10 years ago. The doctor said, hey, there may or may not be something wrong with your kidneys. If you've had that conversation with the physician, even if it was in the emergency room and then you got better and you're having these symptoms, your kidney disease could have worsened. And also of significance is if you're a diabetic, if you're a long-term diabetic and you're having any of these symptoms and they're persistent and are not getting any better, should be of great concern to you. If you're hypertensive, you've been hypertensive all your life and you've noticed that you have any of these symptoms consistently, that could be of great significance to you. And so what's the call to action? What should a person do? Number one, you probably want to not miss your next physical. If you have a doctor's appointment coming up, a physical coming up, you don't want to miss that. And you want to definitely alert your physician like, hey, I'm having these strange symptoms and could I have kidney disease? Could I have kidney failure? And so the physician is going to order some blood work, and a part of the blood work is going to be the Chem 7. In the Chem 7, a really, really important lab that they draw is going to be the creatinine, and it's going to be the BUN, the blood urea nitrogen. Those two labs give definite indications of what's possibly going on with your kidney disease, because the creatinine level, a normal creatinine should be 0.8 to 1.1. That is a normal creatinine. Anything above that, it just means the physician needs to do a little bit more digging, maybe do a little bit more blood work, maybe order some other tests that needs to be done, and you need to be monitored or followed. So just because your creatinine is elevated in that Chem 7 does not mean that you have kidney disease, but it just gives the doctor an idea of how they need to proceed. The other thing in the Chem 7 is the blood urea nitrogen. Normal, well, what is ever normal, is about, I want to say 6 to 19 or about 20 something is considered normal. If your BUN is 30, 40, 50, you in some trouble and you probably need to be definitely followed by a physician. So the biggest call to action is if you're experiencing any of these symptoms, you're a diabetic, you're a long-term patient that suffers from hypertension, these symptoms mean something to you and you need to act accordingly. Follow up with your physician, maybe go to the urgent care department, but definitely you want to follow up, because even if you have chronic kidney disease or, God forbid, in kidney failure, there are things that they can do to make you feel better or even to stabilize your condition. And check out my other video where it talks about how to heal your kidneys, how to stabilize chronic kidney disease, and improve your condition. And please, if you guys like this video, please subscribe to my channel so you can have more content pertaining to chronic kidney disease prevention, treatment, and management. And share this video with someone who you feel like could benefit from this information. And like I said before, thanks again for watching. Bye.